For somebody who is somewhere on that spectrum, which is most people, from insulin resistance all the way to type 2 diabetic, and they've now gotten to the point where their fat cells have been, enlarged. They have visceral fat. Their liver is taking on fat, their muscles. Talk about some of the complications to give people the motivation to do what we're talking about today, who feel like, okay, this is just who I am. We're in this world today where it's politically incorrect to, point out people that are overweight, obese. So there's that whole layer on top of it as well. But there is things like lab work and scans, MRIs, DEXA scans. We can see biological, physiologic changes in people when they are accumulating this fat through their body. So let's talk about why, if somebody is just at that point and they're kind of on the fence here, they want to take care of that. It's not something just to let go.
Right. Okay, so insulin resistance, right? Anyone who's over fat, their fasting insulin will be higher than it should be. Their postprandial insulin will be higher than it should be. And that's basically because they can't dispose of incoming fuels very well because their fat cells are mostly full, their liver is mostly full, their muscles are mostly full. And the fuller these storage depots get, the higher your insulin has to be to try to clear fuels out of the circulation, but it can't. So if I have someone who's super lean and super healthy and has very small fat cells and tons of muscle and this healthy bodybuilding person, their fasting insulin might be a 1, right? But then like average in the US 15 years ago, it was 8 or 9. Now it's like 12 or 13. Fasting insulin normal just keeps going higher and higher and higher. I've got patients who come in, their fasting insulin's 30 or 50 or 70. Now I don't even measure it anymore because it's just, if your triglycerides are too high and your waist circumference is too high, your fasting insulin is going to be too high. And who cares? We already knew that. So, but this insulin resistance is really just a marker for overfatness. And that's your metabolic syndrome. These people have, metabolic syndrome is high waist circumference measured at the belly button, high triglycerides, low HDL, high blood pressure, eventually high glucose. And it's really a metabolic toxicity where you have too many fuels in the bloodstream all the time. And over time, this raises your risk for every single chronic degenerative disease you could possibly name. Cardiovascular disease, radically higher with insulin resistance. Neurodegenerative diseases like Alzheimer's, Parkinson's, ALS, way higher if you're insulin resistant. If you're an ApoE44 and you're insulin resistant, you've got like a 50x risk for Alzheimer's dementia. It's absolutely absurd. Cancer risk, all of your incidence of cancer goes way up with metabolic syndrome. Cancer deaths go way up with metabolic syndrome. Any form of cardiovascular, major adverse cardiovascular event, heart attack, strokes, coronary disease, way higher with metabolic syndrome. Insulin resistance drives every single chronic degenerative disease you could think of, osteoarthritis. Also your common ailments, your acid reflux and your joint pain and your back pain and your heartburn and your autoimmune diseases, asthma, ulcerative colitis, Crohn's disease, rheumatoid arthritis. You can look at symptom scores of autoimmune disease and fasting insulin, and it's just a straight line going up. The more insulin resistant you are, the worse your autoimmune disease is going to be. Fat loss via any mechanism improves almost every autoimmune disease, full stop. So this overfatness and insulin resistance and energy toxicity drives all of these chronic diseases, pretty much everything you could think of. The other thing that happens, and we can't even really measure this, is mitochondria. Okay, so about 10% of your body mass should be mitochondria. These are the energy producing factories in all the cells of your body, right? Or most all of the cells of your body. And when you have a metabolic oversupply to your mitochondria, basically if you're eating too much and not moving enough, so there's just always too much energy present, which is what you have with metabolic syndrome or insulin resistance. This metabolic oversupply damages your mitochondria. You get smaller mitochondria, fewer mitochondria, lower mitochondrial contents, lower mitochondrial function. If I do a muscle biopsy on a type 2 diabetic who's horribly energy toxic, everything about their mitochondria is worse. Fewer, smaller, less contents, less active, less everything. The actual mass of mitochondria in their body goes in. you can actually build up your mitochondria with metabolic undersupply. So if I, shave my calories way down and then do a ton of exercise and have an energy demand, if I'm basically undersupplying and I need way more energy, the exact same thing gets driven in reverse. Your mitochondria, you undergo mitochondrial biogenesis. You could like double the number of mitochondria you have. A healthy person who trains regularly, has good body composition, might have twice the mitochondria of the diabetic. The mitochondria are also bigger, more effective, more efficient, larger contents, larger mitochondrial act. Anything you can measure about mitochondria is better. This is stuff that you can't evaluate in the clinic or on your own. This is just a pure research level thing. We have to do muscle biopsies and then do this fancy mitochondrial DNA analysis or look at it under scanning electron microscopes or just do some crazy research stuff to even know this is happening. But your thin and ripped and jacked bodybuilder is going to have way better, way more mitochondria because of metabolic undersupply. They're demanding way more energy and they're providing way less energy versus your diabetic, who's the exact opposite. And this affects every part of your life. It's just general energy levels. People come in, they're like, I'm just tired all the time. Of course, I can't exercise. I'm just exhausted. I'm tired when I wake up. I'm tired when I go to bed. I'm tired all the time. When I try to work out, I'm pretty feeble. I can't generate a lot of wattage. It's just everything makes me tired. I'm depressed. This is this like mitochondrial thing that I don't even have a way to evaluate in the clinic. I just know it's happening. I just know you've broken these mitochondria with metabolic oversupply, basically eating too much and moving too little. And I also know that these people who are like, wow, you know what? I changed my diet and exercise. I lost a bunch of weight. And now I feel amazing. Like my energy level just skyrocketed. I feel like I could just run through a wall. And, it's just, everything I do is easier and better, and I feel better. A lot of this is mitochondrial, except it's purely theoretical. There's absolutely no way for you to know how this is happening or what's going on. All you can do is eat less calories so you're undersupplying and just be as thin as possible. And then move more, cardio, resistance, general movement to demand more energy. And that is going to optimize your mitochondrial health, except it sounds like a woo thing because we don't have a test for that. There's no way to evaluate. You can't just measure your mitochondria with a measuring tape. You can't just do a blood test. So this is it sounds stupid. It sounds like energy, when people talk about energy and things of that you can't really see or measure. It just sounds like a bunch of woo bullshit and garbage. And so I kind of get that. And it sort of is because you can't actually really evaluate this. But the general concept is the thinner and more insulin sensitive you are, and the more you move and the more muscle you have, the better your quality of life is going to be in every way. You're just going to have more energy. You're going to be able to pump out more wattage. You're just going to be able to do more stuff. And a lot of that is mitochondrial, but you'll never be able to actually evaluate that. So once again, like your goal is to always have the highest lean mass and lowest fat mass. Your goal is also to have the most mitochondria. This is probably why birds live longer than any other animal, way out of proportion to how long they should live, right? So you have this graph of how long mammals live based on their size and all these things. But then birds are just way off the curve because they're just living insane lifespans for their size and their brain size and their body size. They should absolutely not live as long as they do. And the reason is they just have crazy amounts of mitochondria and huge mitochondrial densities. And it's because they have to freaking fly, right? When you're flying, your strength to weight ratio is off the charts. The amount of wattage you have to immediately pump out all the time is crazy. They're always just trying to get enough calories to get by, right? So it's this super high mitochondrial density that is probably part of why they have these incredible lifespans. And if you had to generate enough wattage to lift your body off the ground, 10,000 times a day or whatever these birds are doing, it would be a crazy demand for energy that you would really struggle to match with your diet. If you look at a hummingbird and the amount of energy flux going through that hummingbird every day is absolutely insane. Every single day, they eat so many calories that they get an extreme case of fatty liver. And then every single day, they just burn off like an absurd amount of calories. And then they just have these crazy mitochondrial densities and really long lifespans. And it's all just very high energy flux. They're eating a lot and burning a lot. And so the point here is that if you can demand a bunch of energy from your body, but then not oversupply it metabolically, you're just going to get more and more mitochondria, which is going to help your entire lifespan and your health span, and everything's going to be better.
One thing I want to add to that too is somebody who's tuning in and they're looking at themselves in the mirror and saying, okay, I'm not overly fat. My energy's okay. I don't really need to worry about this. There is a genetic factor as well. And you might not have a lot of subcutaneous fat that shows, but yet you can still be a metabolic mess inside and this stuff can still be happening.
Yeah, absolutely. Right. Some people have just genetically very little subcutaneous fat. This is the personal fat threshold. It's super genetic. Look at people from Southeast Asia. They will never, ever get a bunch of excessive subcutaneous body fat. So they look pretty thin. But if you actually measure their waist circumference at the belly button, it's like way bigger than it should be. They've got this little pot belly. And then if you scan them and look at visceral fat, it's way higher percentage than it should be. And I have patients from Southeast Asia. They're from India or some other countries. They look thin. They're maybe 1 pound overweight. They might even have a normal BMI, but they're internally overfat and horribly diabetic. I have patients who gained just 5 pounds of abdominal fat. They're horribly diabetic. They lose it. They're non-diabetic. And they look skinny, sort of skinny fat the whole time. Like you can barely even tell. So yes, if you have genetically low subcutaneous body fat, it's really tough to know. I also have patients who have a lot of subcutaneous body fat and they look kind of fluffy all the time, but their triglycerides are very low, their A1C is low, their fasting glucose is low, everything's fine. And they just have more insulation because, their ancestors have been living in Northeast Asia for the past, 50,000 years. And so they just store more subcutaneous fat. So there's these major genetic factors, and you could actually be fairly sensitive at way higher body fat percentages or super diabetic at way lower body fat percentages. It's just like BMI. BMI doesn't tell you what percent is muscle and what percent is fat. So on a population basis, it's helpful, but on the individual basis, it's crap because your bodybuilder is going to be obese on BMI and they have no body fat. Same thing with appearance. It's a little bit deceiving. A better option is to measure your waist to height ratio. You measure your waist circumference right at the belly button, basically abdomen fully relaxed, standing up. You measure your waist circumference right at the belly button. That should be less than half your height. If it's over that, you're probably in trouble. No matter what your weight is, no matter what your BMI is. And so this is one good thing to measure. I also really like fasting triglycerides. You don't want to be over 100. Fasting triglycerides over 100, you're probably somewhat insulin resistant. You're somewhat running out of storage room. Lower is better. So those are two really good ways to know how you're doing internally.
Good point mentioning the fact that it goes both ways, that somebody could look overweight and actually be metabolically healthy as well. If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Your whole goal in life is to get the highest lean mass at the lowest fat mass. Basically, you want to be a bodybuilder. So if I just snap my fingers and you're a bodybuilder, you have very little body fat, tons of muscle. This is the very best.